Good morning, everybody. Welcome for being here and joining us on our second day of the conference this week. And before we get started, just as yesterday, some morning announcements, welcomes, introductions, that kind of thing. First, I would like to thank all of our steering committee members who helped out this year with planning, preparing, giving feedback, input, ideas, everything on the conference. We just appreciate their time. They met monthly, gave their time and attention to just making sure that this conference is all the content that is most relevant and the kind of information that you need, which is hard to do with things that are just constantly changing in the health coverage policy world. So really appreciate their time. And so the steering committee this year included Helena Gilbertson, Jennifer Ball, Elizabeth Rothy, Maciel Gomez, Rebecca Rebholz, Nona Crow, Ellie Freeman, Julia Garvey, Chris George, Christina Keeley, Cindy Netwall, John Rathman, Justin Rivas, Mike Rust, and Amy Sather. So thank you again, all of you, for your time. If being on the planning steering committee is something that's interesting to you or you'd like to be a participant of, definitely reach out to us and let us know. We only take a little bit of a break before we start planning for the next year. And so now is the time if this is something that you'd like to be a part of as well. We also, as you may have heard and probably saw on the introductory slideshow that we share each morning, in October 15th, we'll have a webinar really focusing on immigrant coverage eligibility. This is an important topic. It was something we considered including as part of the conference. So many things that we needed to include in the conference as well, and we wanted to make sure that for that topic we had the latest information, which is still evolving. And so we decided to push it out a little bit further. Please do come and come back to not this platform. It won't be here, but we will be sending out a registration link, and Covering Wisconsin will be hosting it. So keep an eye on your emails from Covering Wisconsin and be sure to register for that. I think we will be sending that out later this month. And again, that actual webinar will be happening on October 15th. Later this week, we will be having something that we also offer each year at the close of the conference that we generally term office hours. It's really meant, it's open to anybody, and it's really focused on those who are new and preparing for their initial licensing, because we know there's just so much information to just kind of digest from the conference. We try to make ourselves available, and specifically Adam Van Smenkeren, who is the Covering Wisconsin Navigator Program Manager. He will be hosting that. He's been a navigator for many years, and so lots of expertise and experience, and so really there to help you digest the information that you've learned and to ask your questions, especially as you start to think about taking the licensing exam. So that'll be this Friday, September 13th, 2 to 3 p.m. If you go to the Covering Wisconsin Conference webpage, there is a link there. It's you don't need to register. It's open to anybody. And so you can just go there and click on that link and join this coming Friday. And then all the sessions are being recorded, and we do make those available after the conference. It typically takes at least a day or two to post those, but those will be available. We know that there's a lot of sessions with a lot of information, and so sometimes it's helpful to just go back and re-listen to some key content. So do know that those will be available. The PowerPoints will be coming a little bit after. Those will typically be posted in the following week. So today we have 3 sessions. This morning, first up, we have a session that's going to be focusing on Medicaid topics that often pose some of the more challenging situations that enrollment assisters face, and often are things that we just, not that there isn't information about them, they just kind of, they're not as talked about as frequently in detail. So we did want to give that some attention. So I'm really excited for the first session. The second session will be focusing on coverage costs, that helping consumers understand what the costs are that they may be facing with different coverage options, and also at the same time how to try to avoid medical debt. And so thinking about how can you communicate about those options and helping them parse through all of that information. And that's definitely something we saw in some of the polling questions from yesterday that came up frequently. So really important topic there. And then finally, we'll wrap up the day from hearing from consumers themselves. This was an important session we held last year, and we wanted to do it again this year with a new group of consumers to hear their perspectives. That's really just so much of what shapes your work and how you approach it. And again, the kinds of things that you need to focus on and prioritize when trying to communicate about enrollment and choosing options. So first, we'll kick it off with our first session, which is being facilitated and moderated by Covering Wisconsin and staff person Tina Marshallek. She is both the navigator and our interim community relations coordinator. She is based in Madison, and she serves the full state of Wisconsin to really support, in addition to being a navigator, supporting outreach, being present at events that are ongoing throughout the state, and helping just to raise awareness among other professionals about Covering Wisconsin and the navigator services and what they can provide. So with that, I am going to hand it over to Tina to take us into the first session. I'm looking here, it looks like maybe we had a bit of a technical challenge with Tina joining. She was here and then she had to log off. Let me just check our thread here. Yep, looks like it. Oh, there she is. All right.
Thank you. Sorry, I was knocked off the platform, but I am back. Good morning, everyone. My name is Tina Marshallek. I am the Interim Community Relations Coordinator and a Health Insurance Navigator for Covering Wisconsin, and I have the privilege of being your moderator for today's session about supporting Medicaid members. My plan for today, or our plan for today, is we have two sections to this session. First, we'll hear from Wisconsin State Dental Director and Chief Dental Officer, Dr. Russ Dunkel from the Wisconsin Department of Health Services, as well as Covering Wisconsin Navigator Nicholas Duke about supporting Medicaid members with dental and vision care. So we're including a state perspective and an enrollment assister's perspective. Following their presentation will be 5 minutes of Q&A. So as questions occur to you, please feel free to include them in the Q&A. We'll have a brief Q&A in the middle of the session. Next, we'll hear from two more professionals from the Wisconsin Department of Health Services within the Division of Medicaid Services, Autumn Linsmeyer, who is the Benefits Policy Section Manager, and Nicole Huffman, who is the Section Manager of the Healthcare Eligibility Section, to learn more about current Medicaid program and policy updates. And their presentation will follow another 5 minutes of Q&A, at least 5 minutes of Q&A. Both sections included topics highly requested by enrollment assisters for this year's conference, so I am excited to hear from all our speakers today. To set the stage for our section about vision and dental care, I want to share that Wisconsin covers dental services for all Medicaid members, including adults. All states are required to cover dental services for Medicaid members under 21 years old, and in Wisconsin, it includes adults as well, meaning over 21 years old. Consumers may not know how to access dental or vision care when they sign up for Medicaid or when they have Medicaid. So the role of enrollment assisters is very important because we can help them understand how to use their Medicaid coverage, not just how to have it. Assisters can also help consumers find dental and vision providers who accept Medicaid, as well as other free or reduced dental and vision services. So without further ado, I'll introduce our speakers for this section. Dr. Russ Dunkel is the Wisconsin State Dental Director and Chief Dental Officer in the Wisconsin Department of Health Services, where he works in both the Division of Public Health and the Division of Medicaid Services. He graduated from the University of Illinois College of Dentistry and completed his hospital-based residency at Mount Sinai Medical Center in Milwaukee in 1982. Dr. Dunkel has over 38 years of clinical and teaching experience, as well as having been credentialed to perform dental treatment in hospital operating rooms. His teaching experiences include Marquette University School of Dentistry, the University of Illinois College of Dentistry, and MATC School of Dental Hygiene. He is currently involved in several state and national healthcare projects, including the U.S. Indian Health Service, National Work Group of the American Dental Association and the American College of Emergency Physicians, the Association of State and Territorial Health Officers, and he is the current president of the Association of State and Territorial Dental Directors. In addition, he has co-authored several state and national toolkits and manuals, as well as the first dental chapter in a prestigious medical textbook on chronic disease and epidemiology. Our second speaker for this section is Nicholas Duke. Nicholas Duke is a health insurance navigator with Covering Wisconsin. He has been a navigator since the first open enrollment of the Affordable Care Act, and he's been part of Covering Wisconsin for 8 years. Nick received his undergraduate degree from Marquette University in Writing Intensive English and Criminology and Law Studies, and his Master's in Business Administration from Concordia University. So I will let Russ take it away, since he is our first presenter of this section. All right, and Russ, you are on.
Can everybody hear me?
Sorry?
I was wondering if everybody can hear me okay. You're getting an echo?
Sure. Are you having challenges sharing your screen?
Yeah, it's not coming up.
Okay. I can see on the sidebar that Nick's slides are currently being shared. Does he need to, maybe he needs to stop sharing so that Russ can share. There we go. Now try.
The bar's not showing it. We're sharing.
I can share your slides if needed. Here.
Okay. We're getting an echo.
Okay. Are we seeing them in presenter mode? Yes. If I can get verbal confirmation. Okay. Russ, if you want to present, I'll just move your slides for you.
Okay, can you see them okay? Oh, there. Why are they not in presenter mode though?
Sorry?
They're not in presenter mode.
They're not in presenter mode.
They're not in presentation mode.
Thanks all for the patience with the technical challenges.
Mm-hmm.
How about now? Presenter mode? Russ, can you see them in presenter mode?
Yeah, now I can see them.
They are? Okay, great. Then feel free to take it away.
All right, great. Thanks, Tina. I apologize for getting an echo. I'm getting an echo here. Now I just realized the slides.
No worries. So I think we're starting things off with a polling question, if we want to start that.
Is that coming up?
Can someone confirm for me whether the polling question is started? I unfortunately can't see it since I'm sharing slides.
Yeah, I can't see it either.
Yep, it's on the screen. If you'd like, I can go ahead and read that and get that going. So attendee C is the question: health check is a Medicaid healthcare benefit created for And then they need to answer what they think it's created for. So the first option is young people up to age 16, members of all ages, adults over age 65, young people under age 21, and then finally, none of the above. So we'll give people about 15 more seconds to choose their answer, think that through, figure out which one they think health check was created for. And then we can close that in maybe 5 seconds. All right, and I will share the results. So most people, 68%, said members of all ages. And then after that, we have 13% at young people under age 21, 9% young people under age 16, 6% adults over age 65, and then 4% none of the above.
Okay, Russ, do you want to share what the correct answer is?
Sure, the 13% was right on. It's young people under age 21.
Okay. And here's your first slide.
Great. Well, thanks everybody for the introduction. Sorry, there's the technical difficulties, everybody. Hopefully you've all had your caffeine on and are ready to go. I know with all the presentations, we're responsible for letting people know that we have no conflict of interest. Well, I can share that I have no conflict of interest, and I can also share you that no teeth were harmed in the making of this presentation. So moving right along, first slide should be showing the recent dental work. Now the upcoming slides will appear to have more of a provider information update, which is true. But I feel it's important for us to provide you with some of the information, if for no other reason, situational awareness, because you will be the one struggling to see and assist patients to find providers who will accept Medicaid for these members. So it's appropriate for you to have as much background material as you can and dealing with these situations. So I'll run through these slides relatively quickly. In 2016, the dental pilot was initiated as a statutory. It was basically installed in 4 counties: Brown, Maritime, Polk, and Racine being an HMO county, where it says 50% rate increase on selected dental services. What that means is that all of the child services, again, this could be 20 and under, that Medicaid coverage would receive a rate increase, and 11 adult emergency services also received a rate increase. The remaining adult benefits would not. Going on in 2017, St. Anne statute, some of you may be familiar with this, our dental family clinic. This was a clinic that I was actually the initiating director, started a clinic in the Milwaukee area that solely treats special needs patients, and was established in 2015. The statute was developed after Governor Walker and also Speaker Voss separately had visited the clinic and was able to see the kind of work we were doing. The clinic always treats special needs patients, and the statute reads that in order for a clinic to qualify, 90% or more of your patient base has to be special needs in order to qualify for the rate increase. And that rate increase is basically double what the Medicaid rate is. So for example, if a certain procedure was $40, at the end of the year, you will receive another $40 or double what your rate would be. More importantly, across the state, we have a 40% rate increase that went into effect on January 1st of 2022 after a budgetary or statutory language was put in 2021. This basically covered all dental procedures that were covered by Medicaid, except in the 4 pilot counties, the procedures under child services and also the adult emergency services did not receive a rate increase, but other Medicaid services that were covered did receive that 40% rate increase. Next slide.
And Russ, I was just going to chime in. You're a little muffled, and I know some of our attendees are having some trouble hearing you. Is it possible to know if you're maybe just getting closer to your computer, it might help out a little bit.
I'm also getting a lot of feedback is the problem. How about you?
Okay.
Did that help?
That might. Let's try a little bit longer, and then I can chime in if it's not.
Okay.
Improved.
Again, sorry everybody for these technical difficulties. I'm going to go quickly this slide. Teledentistry was basically approved synchronous and awareness of the years provided. The provider webinars are more probably appropriate for you to be aware of. That in 2023, the Division of Public Health, along with Medicaid and Gainwell Technologies, developed 3 training videos for providers, one on prior authorizations, another one on claim, and another one on how to manage a provider portal. These are critical, especially for the managed provider portal, because it allows providers, trains them on how to manage the portal presence and to let them know that they can do so at the very longest it would take them 24 hours in order to do so. But usually that portal presence can change within less than that time frame. So it gives them the option to manage their portal presence. This kind of goes for the providers to reduce their risk of what they're concerned about of their staff being inundated with calls with providers because they can regulate how many patients they see on a regular basis. Also, at the same time, we developed 4 testimonial videos, including myself and 3 other colleagues in conjunction with the WDA and the DHS Comms team, Medicaid, and myself, basically explaining that you could be a Medicaid provider, you don't have to treat everybody, but the importance of being a Medicaid provider. And finally, the virtual dental team was created last fall, and this primarily was set up in order to address several of the ongoing issues that we've seen. And this was involved as the result of working with the Medicaid director, deputy director, and all the bureau directors within Medicaid. So there's quite a number of people that are involved in this process going forward.
And Russ, I'm wondering if maybe we can pause yours, see if we can adjust your settings a bit. And I'm not sure if you have a headset, maybe you could plug in. And maybe what we can do in the meantime is, I don't know, Nick, if it makes sense for you guys to switch it up or another poll question.
We can switch to Nick for now and go back to Russ.
Okay, yeah, let's do that. Let's do that. Ready to share some of your content while Russ sees if he can improve the sound quality. And I think Tina's going to share Nick's slides.
Are we able to hear me?
Yes.
Okay.
Nick?
Okay. Hi, I'm Nick Duke with Covering Wisconsin. I know Tina already introduced me. I am going to talk about a little bit more of the consumer and assister side of vision and dental for Medicaid members. One of the biggest things that I see as a navigator is that consumers don't know that vision and dental is covered with Medicaid. So it's really important as assisters that we are sharing that information with our consumers that they do have vision and dental coverage. And with that, letting them know specifically what is covered, and I will get into that as well, and helping them find providers that accept the vision and dental for Medicaid. So one of the main things for Medicaid is that it does cover glasses, frames, and lenses at 1 pair per every 12-month period. And technically, Medicaid will cover contact lenses. However, it is under unique circumstances only. So for most consumers, contact lenses really wouldn't be an option. If you're working with a consumer who is really adamant about contact lenses, that would be more of a one-on-one conversation, and you would have to get into the details about specifically why they would need contact lenses over frames and lenses over glasses. And they do cover replacements, but again, those replacements are only once every 12 months. So the most important thing here for consumers to know is that they can get glasses, but they can only get them once every 12-month period, and contact lenses most likely will not be covered. I did include a link in the presentation for a comprehensive overview of the vision coverage. So when the slides get shared, you can go ahead and use that link to delve deeper into the vision coverage if you are working with a consumer, or just to get some backup knowledge on more extensively what is covered for vision with Medicaid. So there are a lot of common challenges that assisters and navigators see when working with individuals in the Medicaid population as far as vision and dental. One of those being that depending on where you are in the state, it can be difficult to find a provider. There already are not a ton of providers that are accepting new patients or accepting Medicaid overall. So if you are in a more rural area of the state, it can become even more difficult. You can have to drive further. And then something else that I hear quite often from consumers is that once they do find a provider, some of the difficulties they run into are those providers don't want to do more extensive dental work. They are quick to just pull teeth rather than doing some more major dental work. So finding a provider that you are happy with, as well as one that is going to accept your Medicaid and is taking new patients, and that you can get an appointment with sometime in a reasonable time frame, can be very difficult. Another issue that these consumers see when they do finally find those providers and are going to pick out their frames, that frame selection is extremely limited. Usually about 5 or 6 pairs only are covered by Medicaid, and those frames don't change. So you're going in once a year, every 12 months, and it's going to continually be that same frame option. That is one that I've heard more from parents of children on Medicaid. The children are looking to get different frames and different styles, and they're limited to that one tray of about 5 or 6 frames that is pulled out, saying this is what your insurance covers. And then I always like to point out to my consumers that it is providers that are covered, not clinics. So providers individually contract with Medicaid. That doesn't mean their whole practice or whole clinic is going to accept Medicaid. So when you are looking for a provider, you want to make sure that the appointment you make is specifically with the provider from that clinic that accepts Medicaid, and that they are accepting new Medicaid patients. When you're searching, sometimes you can come up with a full clinic back in your search, but that doesn't necessarily mean that every provider within that clinic is going to accept Medicaid. I am going to show you a DHS Forward Health Directory that is a fantastic resource to help find providers, and they do have a specific dental provider section on there. So that resource is really great. The link is in the slides. And right there, you can see it on the screen, the Forward Health directory. And you see up at the top there, those boxes are actually clickable. So you'll want to click on the dental before you type in the search information. And that is a great resource. And then here is another DHS resource. It is an interactive map where you can find dental clinics in Wisconsin based on your area. And then also donated dental service programs. So there are providers and volunteer dentists that volunteer their time and their services for those individuals that are having trouble getting dental work or dental coverage. The Donated Dental Service Program has been around since 1998, and it does a lot of great work, and it is 100% donated. The materials, the staff, the services, so everything is donated. So there is no cost to the consumer. There are requirements to be able to use the donated dental service programs. You have to be unable to afford the needed care, limited income, and there are other things as well. So, while it's a great resource, not everyone will qualify for donated dental services. And there's also dental clinics and other dental programs for free or low cost dental. Again, we've included a link to the webpage that you can look at to find these clinics in your area to help your consumers find free or low cost dental care. We know dental care is really important, and it is something that we want everyone to be able to have access to. And then actually, one last thing about the dental care before I move on to the vision resources. I wanted to, I just wanted to make note that, again, the different areas of the state have different access to dental care. So it's really important to figure out where the consumer you're working with is going to be at. I know the rural areas, even the donated dental services or the free or low cost clinics can be more difficult to get to. DHS also has a lot of vision resources for consumers. They have the list here of the resources where you can find the free or low cost vision care. So if you are unable to find a provider to accept the Medicaid, or you need services that you can't get through the Medicaid providers, or maybe you're working with a consumer who is not on Medicaid at the moment, there are other free and low-cost vision services. And again, the link is on the slides. So when the slides come out, you'll be able to go ahead and click those links and get those resources.
Okay, thank you, Nick. I think that's the end of your slides.
It is. I did have one last thing. So I thought there was one more slide. In the Milwaukee area specifically, I wanted to note, if you are having trouble finding a dental provider for Medicaid, if your consumer is in an HMO, you can contact the HMO and contact the HMO member advocate. And they are a great resource for those consumers whose dental is taken care of through their HMOs. Those HMO member advocates do a great job of having the availability of the dentist that they're currently contracted with and can help out a lot.
Okay, great. Thank you. If I can get Russ to go on mic again, and I will share your slides again. And for the sake of time, we just have a few slides to go through. Russ, can you hear me?
Yeah, can you hear me?
Oh, that's so much better. You do sound much better. Thank you so much for the flexibility. All right, so I have your slide shared where we left off, and feel free to take it away.
Feedback, so.
Are you able to?
Okay, you want to go where we left off, or Elena said people were having trouble hearing?
It says accomplishments of the virtual dental team. I believe this is where we left off.
Okay, you can hear me okay? So
yes.
Some of the accomplishments of the virtual dental team, as I'd mentioned before, this was some of the more key points are actually more below, where what we're looking at is one for policy clarification for dental providers is that, you know, there is no application fee, whether you're applying for regular Medicaid provider or there is a situation where you can actually qualify and apply for an emergency dental provider, which will allow you to be an emergency dental provider for essentially 24-hour time frame. And there used to be a thought process that there was an application fee, but dental Medicaid has never charged any dentist for the application fees, either for the regular or. So that may be something you'll need to let consumers, providers know if you reach out to them. The other thing that I don't know if you can see is also with, when we're talking about special agents, those that require IV sedation, there's been updates both from CMS and the state Medicaid program where we've basically had a modifier code to increase facilities fee for IV cases for pediatric and special needs cases that do require OR time or have to be treated with an IV in ambulatory surgery centers. Now, the problem is I know Nick went over the donated dental services. So again, this with the orthodontics, you can go forward one more slide. Yeah, and go back one. Thanks. No, I'm too far. Sorry, everybody. Yeah, so DMS is working on what's called a long-term automation process. We just went live with an automated PA process for dentures on other procedures as well. This streamlines the time frame that providers will have to put into if they meet certain qualifications in order to get an authorization approved. Now, unfortunately, we seem to be having technical difficulties. What I was hoping to do is go through a little more detail what Nick had brought up. When the oral health program page, when you go to that interactive map that shows some of the various free and charitable clinics, you want to make sure that you expand that map, because in the view that was originally shown, it may look like there's only 3, but if you expand the map further, you'll see that there's approximately 7 clinics in, for example, the Madison-Dane County area that offer free and charitable services that are either safety net clinics or free and charitable. The clinics you're probably most likely to encounter or be working with are FQHCs, which are federally qualified health centers, free and charitable or safety net clinics. Some of you, depending on where you're located, will be working maybe with tribal or veterans clinics. But I think the 3 that I just mentioned, or rural health centers, are more likely going to be the ones that you're involved with. There is the Marquette Dental School, and there also are 8 dental hygiene clinics in the state of Wisconsin. But again, be aware of that with the dental hygiene clinics, they provide periodontal or gum treatment services, as well as radiographs and examination, but they do not cover anything from a restorative standpoint or emergency services for extractions, etc. And I know Nick also had mentioned the donated dental services. the other thing that he, I don't recall it if clarified, is that system is only for individuals that don't have Medicaid. So you have to be uninsured and also meet a financial benchmark that if you can only make so much money, similar to what would be considered with the federal income policy as well. So with that, why don't we go to the questions then, Tina? And again, sorry to the participants for the issues that we've had with technical difficulties.
Tina, would you like me to read some of the Q&A that we have? I'm not sure how much time you'd like to.
I have. I'm ready. Thank you.
Okay, great.
Here's a question. So what would you say to a consumer who is new to Medicaid and they have a root canal scheduled? Is that covered?
Well, it depends on the age of the patient and what tooth area that we'd be talking about. So for example, molar root canals could be covered, but it will require a prior authorization, where if we're talking a front tooth, that would be covered by Medicaid. So for example, a central incisor, et cetera, would be covered by Medicaid. Now for children, again, under the age of 20 and under, they would be covered for both what would be called anterior premolars and molar teeth as well. But if they reach a certain number, that requires prior authorization. So there's various caveats that come into play on that.
Sure. Awesome. Thank you. And it's okay if we don't have the answer to this question. We may need to take it back and post the answer later. But somebody asked if a parent or donor wants to pay more to get a different pair of frames for a child. Is that possible? So that's a vision coverage question.
I can take that, if that's okay.
Yeah, go right ahead.
So yes and no. They could pay for a different pair of frames, but they would pay the full cost of the frames. Medicaid won't cover a certain amount, and then you can pay the rest. So it wouldn't be like, oh, the Medicaid frames are all $100. I want to buy a $200 pair, so I'll pay the extra $200. It doesn't work like that.
Okay.
You would just have to pay the full $200.
Understood. Thank you, Nick. And one last question before we move on to the next group. And then if we have time at the end, we can answer these other questions. What about oral surgery for impacted wisdom teeth? Is that covered under Medicaid?
Yes, it is covered under Medicaid services. Again, it could be age related as well. So there's some caveats with that might require prior authorization, but it is covered. It is a covered procedure and a covered benefit.
Okay. Well, thank you both, Russ and Nick. If we have time at the end, I'm happy to go over the remaining dental and vision questions. Otherwise, we can take them back and answer them later. And we can move on to the next section of this session, which is through the Division of Medicaid Services, going over program and policy updates. I'd like to introduce our next set of speakers. First, we have Nicole Huffman, who serves as the section manager for the healthcare eligibility policy section at the Wisconsin Department of Health Services. In this role, she leads a team of analysts charged with interpreting state and federal Medicaid policy, as well as implementing projects and improvements related to Wisconsin's healthcare programs. She has spent 16 years working in various roles at DHS, and her expertise spans across the Wisconsin Medicaid, Badger Care Plus, Wisconsin Well Woman Medicaid, Senior Care Prescription Drug, and Supplemental Security Income programs. Nicole has a bachelor's degree in political science and legal studies from UW-Madison, and an MBA with emphases in healthcare and public administration. She lives in DeForest with her husband and 2 sons who are ages 1 and 4. Our second speaker is Autumn Linsmeyer. She is a public health policy professional with over 8 years of experience. Currently, she is the Benefits Policy Section Manager at the Wisconsin Department of Health Services. Her work is focused on Medicaid benefits such as dental, early and periodic screening, diagnostic and treatment, or health check in Wisconsin, and the HIV/AIDS Health Home. She obtained her bachelor's degree in political science from UW-Madison, and her master's is in public administration from UW-Oshkosh. And I will leave it up to them. Great. Looks like we're starting with Autumn.
All right. Can you hear me okay?
We can. Thank you.
Perfect. So good morning, everyone. My name is Autumn Linsmeyer. I am the Benefits Policy Section Manager, and today I am here to talk about the Consolidated Appropriations Act, also known as the CAA Incarcerated Youth Project. Next slide. So today I'll give a brief overview of the CAA, discuss our phased approach timeline, and next steps. Next slide. Okay. So for CAA background, the CAA introduced 2 required updates to Medicaid. So the first one is the required update to eligibility for youth with justice involvement. This means that Medicaid should now suspend instead of terminate eligibility status when a youth enters the justice system. We're already in compliance with this requirement, so we don't need to do anything additional in this space. The second requirement is a required update for states to provide services to eligible youth with justice involvement 30 days prior to release or within 1 week or as soon as practicable after release. And those required Medicaid services include the EPSDT health checks and targeted case management, also known as TCM. Next slide. So the eligible population for these services include inmates of a public institution that are eligible for Medicaid prior to or during incarceration that are under the age of 21 or former foster care youth under the age of 26 that aged out of the foster care system at age 18. Next slide. So what is EPSDT? The purpose of EPSDT is to ensure that children receive early screenings and care so that problems can be prevented or diagnosed and treated as early as possible. In Wisconsin, we also use the term health check, which means the same as EPSDT. So this health check benefit provides periodic screening exams as well as interperiodic screens and additionally medically necessary services referred to as Health Check Other Services in the state of Wisconsin. Under the CAA, Health Check Other Services is not allowed. Only the Health Check health screenings are allowed under CAA. And so when a screening examination indicates the need for further evaluation, diagnostic services must be provided and necessary referrals should be made. This aspect is also included under the CAA. Next slide. So we have several aspects included in the EPSDT screenings, including comprehensive health and developmental history, comprehensive unclothed physical exam, immunizations, lab tests, and health education. Next slide. Additionally included is dental screening, vision screening, hearing screening, and mental health screenings. Next slide. So what is TCM? Targeted case management exists to assist members when appropriate and when appropriate their families to be able to coordinate a full array of services. And under the CAA, targeted case management includes referral to the appropriate care and services that are available within the geographic region of the eligible juvenile's home or residence. Next slide. And so our timeline. Right now we are working on phase 1, which is the federal requirement to have this implemented by 1/1/25. And this includes existing EPSDT and TCM providers will be able to bill for services in place of Service 9, also known as the correctional facilities. So we've heard that some county health department staff may be going into Department of Correction facilities to provide these services. In phase 2, that will include more additional work and enrolling additional providers. And so we will begin work on that after phase 1 is completed. But right now we are just focusing on those existing EPSDT and TCM providers and making sure they have access to get into correctional facilities and are able to bill for those services. Next slide. And next steps. So we will continue to work with the Department of Corrections, the Department of Children and Families, and the Division of Care and Treatment Services within DHS. Additionally, we will be sending out a forward health update for phase 1 later this year. And as we move throughout the other phases, additional communications will be sent out to providers. Next slide. And our polling question, true or false? Youth who are currently incarcerated can receive Medicaid services or benefits in correctional facilities.
Okay, if we can get that poll question posted. Looks like people are answering. We'll leave it up for just a second before we share the results. Okay, people are still answering. I'm going to give you another second. Okay. It looks like we are split about 60-40 on this. 61% said true and 37% said false. Autumn, would you like to share any feedback on that?
Sure. So since we're talking about current state as of September 10th, they are not allowed to receive Medicaid services or benefits in correctional facilities, but that will change 1/1/25 because of the Consolidated Appropriations Act. Next slide. Okay. That is all I have. Thank you.
Together. Thank you, Autumn. Okay, so now Nicole will present her slides. Yes, somebody in the chat asked if I could repeat what the answer was for the last poll question. The answer is currently no, but that is soon to change in January. The answer will be yes as of January.
All right. Are we ready to start? Or
yep, your slides are showing perfectly, and feel free to take it away. Thank you.
All right, thank you. So good morning, everyone. Again, my name is Nicole Huffman, the section manager for the Healthcare Eligibility Policy section. And I'm going to be providing an overview of some policy changes for Badger Care Plus and the Medicaid purchase plan, specifically the reinstatement of premiums for these programs. So in this presentation, we are going to walk through some changes that were made over the past year for Badger Care Plus childless adults, Badger Care Plus children, and the Medicaid purchase plan known as MAP. So first, we'll talk briefly about Badger Care Plus childless adults, which are adults ages 19 to 64 who are not receiving Medicare, except for the Medicare Part B immunosuppressive drug benefit, or Part BID, and do not have any dependent children. So back in February of 2020, the department started rolling out new policies for childless adults enrolled in Badger Care Plus. Under the terms of our waiver, we provided coverage for childless adults with income up to 100% of the federal poverty level, but we started to require monthly premiums for some members with income over 50% of the federal poverty level. Childless adults needed to answer a treatment needs question about substance abuse as a condition of enrollment, and there was an optional health survey that could reduce monthly premiums. Based on federal requirements, we suspended these policies at the start of the COVID-19 public health emergency in early 2020, just a couple of months after they had started. And then on November 17th of 2023, the Centers for Medicare and Medicaid Services revoked Wisconsin's authority to impose monthly premiums and require the treatment needs question as a condition of eligibility. So these authorities ended December 31st of 2023, and the policies were discontinued. So the next population is Badger Care Plus children. So I came to this conference last year to introduce continuous coverage for children. The Federal Consolidated Appropriations Act of 2023 required children in certain Medicaid programs and the Children's Health Insurance Program, or CHIP, be provided with 12 months of continuous healthcare coverage with some limited exceptions effective January 1st of 2024 to reduce gaps in coverage, increase the efficiency of healthcare spending, and reduce healthcare disparities for children in low-income families. So continuous coverage means that the children under 19 stay covered through their certification period, even if the family situation changes. We implemented 12 months of continuous coverage effective January 1st for most children in Badger Care Plus and Medicaid. The exception is children who are enrolled under presumptive eligibility and children who are required to meet a deductible in order to enroll in Badger Care Plus or Medicaid. So qualifying children under 19 will only lose their coverage during their 12-month continuous coverage period for the following reasons. The child turns 19, the child is no longer a resident of Wisconsin, the child passes away, the child's citizenship, identity, or immigration status is not verified within their reasonable opportunity period, the child was eligible as a pregnant minor and they have turned 19 and their postpartum period has ended, or there is a voluntary request for disenrollment from Badger Care Plus or Medicaid. One thing that is not on this list is failure to pay a premium. Some of you may recall last year that there was some uncertainty about whether failure to pay a premium would result in loss of continuous coverage, but CMS did end up issuing guidance prohibiting disenrollment for failure to pay a premium. So let's talk a little bit more about premiums for children. So premiums were temporarily suspended during the federal public health emergency. Wisconsin state law requires that premiums be charged to certain children enrolled in Badger Care Plus, so DHS reinstated premiums for children as of April 1st of 2024 after the federal public health emergency had ended. Premiums are charged with exceptions to Badger Care Plus children with household income above 201% of the federal poverty level. The amount charged is based on the child's family size, income, and the FPL guidelines. And premiums will never be more than 5% of the family's counted income. And this chart here on this slide outlines the premium amounts for children ranging from $10 to $97.53. This slide outlines how premiums were reinstated for children. So for new applicants on or after April 1st of 2024, premiums are charged based on the household's income. For existing members, so those enrolled before April 1st, premiums are not charged until their next scheduled renewal due April 2024 or later. Letters about the reinstatement of premiums are sent to members on a rolling basis in advance of their renewal, approximately 45 to 60 days before their renewal. And for new applicants, premiums apply, but existing members, premiums are reinstated on the rolling basis. So for people who are enrolled prior to April 1st of 2024, they may not be reinstated until later this year or through early next year, depending on when their renewal is. And then premiums were not simply reinstated under the same policies as what was in place pre-pandemic. As I noted previously, state law requires us to charge premiums, and CMS does not allow children to be penalized or lose coverage for failure to pay those premiums. So based on the continuous coverage rules, premiums can also only be set at the child's application or renewal. During their 12-month continuous coverage period, premiums can be reduced, but they cannot be added or increased. In addition, we made changes related to initial premiums. Premiums are no longer a condition of enrollment. They're only charged for future months, not the current or backdated months. We also expanded the options for members to pay their premiums. Previously, members paid premiums for children by check, money order, or by setting up electronic funds transfer, or wage withholding. Members are now able to pay premiums using a credit card, debit card, or EFT from a checking or savings account using the Access website or the My Access mobile app. They can also view premium information and payment history through Access and My Access. And finally, we're going to talk about MAP. So like Badger Plus, premiums for MAP were temporarily suspended during the federal public health emergency, but were reinstated as of August of 2024, so just last month. MAP members with gross monthly income above 100% of the federal poverty level are subject to premiums. In preparation for the reinstatement, the department worked with partners across the state, and we sent letters in June to all MAP members. For those with income up to 100% of the federal poverty level, the letters informed them that premiums were being reinstated, but they would only be subject to them if their income went above 100% of the federal poverty level. For those with income above 100% FPL, the letters informed them that premiums were being reinstated, and based on their income, they would be subject to them. They'd receive a notice with their premium amount. And then in early July, premium amounts were set, and all MAP members with premiums were sent a notice of decision. A couple weeks later, they received a premium statement asking for premium by August 10th. For those that paid their premiums, their September premium statements were then sent at the end of August for premiums due today, September 10th. So now let's talk about some changes from prior to the pandemic with MAP. So due to a change in state law under Wisconsin 2017 Act 59, MAP premium policies were changed while premiums were suspended back in August of 2020. Based on the changed premium structure, members who never had to pay a premium in the past may now have to pay a premium. And members who paid a premium before the pandemic may need to pay a different premium amount. With the policy changes, members with gross monthly income above 100% of the federal poverty level are subject to premiums, and MAP members who owe premiums have a minimum premium amount of $25. Premium amounts are based on this new premium calculation of $25 plus 3% of the member's income that is over 100% of the federal poverty level. So for most members who did pay premiums before the pandemic, these changes resulted in lower premiums. In addition, members can request a temporary premium waiver due to hardship for up to 12 months for a given hardship reason. And like Badger Care Plus, MAP members can pay and view their premiums online. However, for MAP initial premiums that are still a condition of enrollment at application or re-request, and those do need to be paid by check or money order to their income maintenance agency. So back in 2020, changes were also made to impose a 3-month rather than a 6-month restrictive re-enrollment period for non-payment of MAP premiums. However, based on direction from CMS, there are no longer restrictive re-enrollment periods. Unlike Badger Care Plus, though, payment of the premium is a condition of eligibility for MAP. So if the premium is not paid in full, MAP benefits will end, but they will not go into the restrictive re-enrollment period. While the premium is due on the 10th of each month, if their premium is processed by the adverse action date in the month it is due, their eligibility will not be impacted. If the premium is not processed by the adverse action date, a notice is going to be sent informing the member that their MAP is ending at the end of the month. However, if they pay late, they could still be re-enrolled. If a late premium is processed by the end of the month, they will be reinstated without a gap in coverage and be informed that their MAP has reopened. If a payment is received in the month after benefits closed, it will be treated like a re-request for MAP, and the premium of payment will be applied to the month in which it was paid. Oops, sorry. So for an they closed on August 31st and the premium was received today, it would be applied to September and benefits would be reopened back to September 1st. So they wouldn't have a gap in coverage, even though they never paid August premium. If more than a month has passed since benefits closed, then they would need to reapply for MAP and pay their initial premium in order to re-enroll. All right, so now a polling question.
For the sake of time, we only have 3.5 minutes left, and there are a couple of questions in the chat. I think we should just forego this poll question since we already did 2. Okay. And we could just share that the answer is false, correct?
Correct. There are no longer restrictive re-enrollment periods.
Perfect. Thank you. One question that came up twice in the chat, and thank you again, both Nicole and Autumn, awesome presentations. One presentation that's come up a couple times in the chat is whether the premiums for children are per child or total per household.
They are calculated per child.
Okay.
And then but then they are rolled up to a household level, and all premiums need to be paid.
Okay. Thank you. And there was a question surrounding MAP. It's a bit of a scenario question, so I'm not sure if Rachel might want to jump in. I know there were some challenges surrounding communications going out, or not communications going out, challenges with MAP premiums being posted once they had been received at some point recently. Somebody said that they had clients that were enrolled in the MAP program. They sent in the payments for the new premiums by the due date, and the checks were cashed. However, the staff in the MAP offices did not get the payments posted. So the benefits are showing termed in the Forward Health portal. And this affected a number of medical billings and has caused at least one individual to lose a Medicaid Advantage plan. So the question is, if there is a plan to rectify those challenges. Yes, if there's a plan to rectify those challenges. I'm not sure if somebody wants to give any feedback on that scenario.
So MAP premiums due for the first time on August 10th. Anybody who paid their premium and it was received by the due date of August 10th, their premiums were processed and there was no impact to their eligibility. If they paid after the August 10th due date, then there were a significant number of premiums to get processed, and they were processed in the order received. And so not all of those premiums were processed by the adverse action date, and people could get disenrollment notices of decision. As they are processed, people are getting reopened for MAP. And if received after August, then those would be applied to September. So it's really important to stress to members paying the MAP premiums in full and on time, so that they do not experience any disruption in their enrollment.
Okay, thank you.
Going forward, we have made some changes so that premiums will be processed much faster than they were previously. But again, anyone who did pay their premium by the due date was not impacted by the processing delays.
Okay, thank you. There was one question for Autumn about the changes to youth who are incarcerated. There was a question if the change is for adults as well or youth only. My understanding, it's only changing for youth, correct?
Yes, so there was an optional aspect to the CAA, but our leadership decided not to pursue that optional changes for adults. So right now we are just focusing on youth under the age of 21 or under the age of 26, former foster care youth.
Thank you. And we can take one, actually, I don't think we can take one more question. We are at time, but we will take these questions back. Thank you all so much for your participation. And thank you again to our speakers for all your hard work.
Excellent. Thank you so much. That was such important information. And as we've shared, we will be posting the recording later this week, and then also the slides starting next week. So thank you, Tina, so much for facilitating and moderating that topic. All right, so we have a break, 10 minutes. Make sure that you leave this session and then go back to the main page for the conference on the platform, and then click on the next session, and we'll be joining back there at 9:50 to talk about coverage costs and avoiding medical debt. All right, thanks everybody.